Cardiovascular diseases are the leading cause of death in both the Philippines and around the world. They include major conditions such as heart disease, hypertension, and stroke, which often develop slowly and silently over time. These diseases affect millions of Filipinos, especially those with risk factors like poor diet, stress, and limited access to healthcare. What's important is that most cardiovascular diseases are preventable. Through health education, regular screening, and healthy lifestyle practices, nurses can help communities reduce the growing burden of these illnesses. When we emphasize early detection and lifestyle modification, we are not only treating our clients right, we are helping build healthier communities that value prevention as a shared responsibility. Cardiovascular diseases or CVDs affect the heart and blood vessels. The major types are coronary heart disease, stroke, and hypertension. These are often linked to lifestyle and behavioral risk factors, such as smoking, physical inactivity, and unhealthy eating habits. It is not simply a medical issue, it is a public health concern deeply rooted in modern living. As nurses, our role is to promote awareness and empower individuals to make small but meaningful changes, like encouraging regular exercise, balanced meals, and stress management. These day to day activities and habits can significantly lower the risk of CVDs and improve quality of life. Cardiovascular diseases account for over 35% of deaths in the Philippines, making them a major health priority. Hypertension and high cholesterol are among the most common risk factors that lead to heart attacks and stroke. The increasing prevalence of CVDs is linked to urbanization, stress, and lifestyle changes, which include eating more processed foods, less physical activity, and longer working hours. These trends show the shift from infectious diseases to lifestyle related conditions as leading causes of mortality. Community health nurses must understand these patterns to design effective interventions. Programs that address nutrition, exercise, and stress reduction at the family and barangay levels. Cardiovascular diseases are influenced by modifiable and non modifiable risk factors. Modifiable ones include smoking, obesity, high fat diet, and physical inactivity. All of these behaviors can be changed through education and motivation. Non modifiable factors such as age, sex, and family history cannot be changed, but they alert us to who needs close monitoring. Another important element is psychosocial stress, which contributes to high blood pressure and unhealthy coping behaviors. In community practice, teaching clients how to manage stress effectively through relaxation, recreation, or prayer and meditation have become part of preventive nursing care. At the core of most CVDs is atherosclerosis, the buildup of fatty deposits in the arteries. This narrowing limits blood flow, reducing oxygen supply to vital organs like the heart and the brain. When these arteries become completely blocked, it can result in a heart attack or stroke. Long term high blood pressure further damages the arterial walls, making them less elastic and more prone to rupture. Understanding this process allows us nurses to explain to patients how daily habits like high salt diets or smoking gradually injure their arteries. This knowledge empowers patients to take action before damage becomes irreversible. Common signs of CVD include chest pain, shortness of breath, and palpitations, which may indicate heart disease. Dizziness, fatigue, or sudden weakness are warning signs of stroke, while swelling in the legs and difficulty breathing may suggest heart failure. Nurses in community settings must be skilled in recognizing these early symptoms during home visits or barangay outreaches or going around the barangay or within the barangay RHUs. Quick identification and referral can prevent severe complications, thus saving lives. Equally important is educating families to recognize these warning signs early and seek medical help immediately, rather than ignoring them or resorting solely to traditional remedies. The Department of Health implements the Cardiovascular Disease Prevention and Control Program as part of the National Strategy for Non-Communicable Diseases. Its main goal is to reduce deaths from cardiovascular diseases through prevention, risk screening, and early management. The program promotes lifestyle modification, encouraging Filipinos to eat better, move more, and quit smoking. This initiative reflects the idea that health promotion starts at the community level. Nurses play a major role by translating national policies into action through local education campaigns and regular blood pressure screening activities. The program focuses on three key areas: health promotion, education, community based screening, and referral systems. Health promotion includes campaigns like Go for Health, reminding people to stay active and eat nutritious food. Screening helps detect problems like high blood pressures or cholesterol early on. And strengthened referrals ensures that once someone is diagnosed, they don't fall back. They get continuous care. Our role as nurses is to bring these components to life by teaching, screening, referring, and following up with compassion. But before disease even occurs, what can we do to keep people healthy? Let us talk about primary prevention. Primary prevention means preventing disease before it happens. We do this by promoting a heart healthy diet, low in fat and sodium, high in fruits and vegetables, and by encouraging regular exercise. We also remind our clients to avoid smoking and excessive drinking, the two major causes of heart disease. And finally, we stress the importance of rest and stress management. Adequate sleep and relaxation are not luxuries. They are essential parts of heart care. But what if the disease is already developing silently? That is where secondary prevention comes in. Secondary prevention focuses on detecting diseases early and preventing their progression. This involves regular blood pressure and cholesterol checks, controlling hypertension and diabetes, and ensuring medication adherence. As nurses, we guide our patients through these steps, helping them understand that compliance with medical advice is not optional. It is very important. We build trust, answer questions, and motivate them to stay consistent. For those patients or persons in the community who have already experienced a cardiac event, our goal shifts toward recovery and rehabilitation, which are part of tertiary prevention. Tertiary prevention focuses on helping patients regain function and prevent recurrence. After a heart attack or stroke, rehabilitation programs help restore strength and confidence. Nurses educate patients on proper medication use, dietary management, and gradual return to activity. Beyond physical care, we provide emotional support. Many cardiac patients experience fear or anxiety about another attack. Our reassurance and consistent presence play a huge role in their long term recovery. Of course, nurses are central to all these preventive efforts. Let us now look at our specific responsibilities. Nurses are at the front line of prevention and education. We conduct blood pressure screenings, provide lifestyle counseling, and ensure follow up visits. We collaborate with each other or with every member of the health team, the doctors, dietitians, and barangay health workers to maintain continuity of care. Every home visit, every health teaching session, every counseling session contributes to the national goal of reducing cardiovascular disease mortality. It is a demanding rule, but one that places us at the heart of community transformation. We also need to think about how to engage the whole community in promoting cardiovascular health. Community participation strengthens prevention. Activities like Heart Month campaigns, community fitness drives, and healthy food programs make health promotion visible and enjoyable. Collaboration is key. Working with schools, churches, and workplaces spreads the message to all ages and sectors. These partnerships foster shared accountability for health, making prevention a community movement rather than an individual effort. And how do we ensure that our programs are working? That is where monitoring and evaluation come in. Monitoring ensures our interventions produce the desired results. We document screening outcomes and blood pressure readings in the Field Health Service Information System or FHSIS. We also track CVD trends and evaluate whether our campaigns truly make an impact. This data helps us refine strategies and justify future programs. Remember, good nursing practice is evidence based, and our records provide evidence that guides policy and improvement. To summarize, cardiovascular diseases or CVDs remain the most preventable yet most deadly conditions in our country. Effective prevention requires a combination of risk reduction, early detection, and consistent education. As nurses, we have a unique opportunity to lead the way. Through our lecture, screenings, and counseling sessions, we promote healthier hearts and stronger communities. Let us continue to champion prevention, not just as a policy, but as a lifelong commitment to saving lives.